All right. So we are getting started immediately. So, welcome to the preventive care webinar, uh, part two. Today, we're going to be looking at a very important issue, something that is very necessary that we pay attention to. This is something that most people ignore. For some of you, the ad that brought you here, said something at it. It was pointing at something very, very important. I was talking about how that
For most of us, when we are young, we tend to focus more on things like
like our
making money, moving forward, our success, our different careers, and just getting ahead. And we neglect a very crucial part of our lives, which is our health.
our health, which is our health. And our health is very important, so important that if our health is not in place, every other thing we are doing, every other, you know, thing we are doing doesn't really matter because you won't be healthy to enjoy whatever it is you get. So today we are going to be looking at preventive care with the subtopic how to build a life of health that lasts till old age. How to build um, a life of health that lasts to old age. And with us here, we have Dr. Jane, who is going to be sharing with us potent strategies and systems that can help us begin to, build this life of.
Health that lasts till old age.
I would like to help us begin to understand this concept of preventive care and what it is all about. For us to begin to understand the concept and what it is all about. So, what is preventive care? When we talk about preventive care and all of that, what does it really mean? What is preventive care? Please, if at any point you no longer hear me, put in the comments so that we can adjust and to ensure that you are hearing what we are saying. If at any point you are not hearing us, just put in the comments and then we can make adjustments. So, preventive care, what exactly is preventive care and why should it interest you? Why should we talk about it? Why should we even begin to learn about preventive care? If you have your writing materials, it will do you good to take it up, take what you're going to write with, so that as we learn, you benefit a lot. So take your writing materials um, and begin to write things down. So, what is preventive care? Now, according to the World Health Organization, the World Health Organization defines preventive care as approaching approaches and activities aimed at reducing the likelihood that a disease or disorder will affect an individual, interrupting or slowing the process of disorder or disability. So the World Health Organization defines preventive care or preventive health care as approaches or things that you do in order to either prevent diseases or interrupt its progression, right? So the very premise of this preventive care tells you that it is proactive in nature. These are actions you take to prevent certain things. In other words, it is not what you wait for it to happen before you start, giving it attention. It is actions you take in order to prevent these things from happening, to stop them from happening. Do you understand? Right? So these are actions you take to stop them from happening. Right? So preventive care is about approaches and activities that are aimed at reducing the likelihood that a disorder will occur, right? So that is what we're going to be learning today. What are the preventive care strategies that you can use and utilize to help you build a life of health that will last till old age? Things you can begin to do now that you are young, probably, to slow the process of maybe things that have already started or prevent things that are yet to come to ensure that you enjoy a life of health. So without further ado, I'm going to be bringing on our guest speaker for today, Dr. Janet Thomas, who is proficient at what she does, and she has been in the game for quite a while now. And please put in the comments, put the fire emoji, put the clapping emoji as we welcome Dr. Janet.
Hello, everyone. Can you hear me?
All right. Can you hear me, Doc?
Yes, I can hear you. Can you hear me too?
Yes, I can hear you. Welcome to the Preventive Care webinar.
Thank you so much, Prosper. I'm so happy to be here. Thank you for inviting me.
Thank you for being on here. So I just explained the basics of preventive care and what it is all about, and then you're going to be taking us on this topic and really showing us how to go about building a life of health that lasts till old age. So quickly, you take it away. Start by telling us more about yourself, and then get into preventive care, and we move on.
All right. My name, like you mentioned, because I'm a medical doctor currently working at the hospital. So apart from the work that I do in the hospital, I also like teaching and learning about health, different parties to spread the message and the good news. So I'm so happy.
Oh man, I think our network seems to be bad.
So I'm really grateful to be here. So today we're going to be talking about how to build health that lasts till old age. Can you hear me now?
Yes, we can hear you. Go ahead. We can hear you. Go ahead. We can hear you.
Oh, okay. Okay, that is good. I think the network today is very interesting. So today we are talking about how to build health that lasts till old age, and we are approaching it from the preventive healthcare aspect or approach. Now, the first thing you need to know before you start talking about achieving health that lasts till old age is that you need to really decide what you want. Okay, it's a decision that you have to make for yourself, not a decision that you'll be forced to take. How do you want your health to be when you get to the old age? Some people, the kind of lifestyle they live right now is actually building towards something that they cannot actually be proud of when they are old. So if you want to be healthy in old age, your habits needs to change while you're still young. So I believe on this call, I have different people of different age groups that are listening to me. So they say yesterday was the best time to plant a tree, and today is the next best time. So today, I believe, is the best time to decide, do you really want to live a healthy lifestyle that can help you stay healthy till old age? And it all begins with the decision that you're willing to take today. Now, the first decision you need to take is you need to decide that you're going to start eating healthy. Let me tell you, most people, the reason why they get sick easily is because of what they put into their body. Okay, now let's begin from eating good and healthy food. When I say healthy food, I mean foods that are still healthy. You know, in the hospital, there's there is something that we notice that among people coming from rural area, when we want to talk about their health and all that, apart from the fact that they don't eat healthy food, some of them actually go ahead to eat food that already have fungi growing in them. You don't need to do that. You need to change your diet habits. Okay, make sure that the food you're eating, they are food that are still okay, not food that have spoiled. Now, apart from that, you need to eat food that are rich in nutrients. Balanced diet. You can't eat carbohydrates in the morning, afternoon, and night and expect to live a healthy lifestyle. So you need to balance your diet, and you need to drink water to stay hydrated. We encourage you to drink up to 1.5 to 2 liters of water. And if you can drink more, go ahead and drink water, because your organ, every part of your body needs water to function. The more you drink water, the more it helps to flush out the toxins that accumulate in the blood. So you need to drink enough water, and then limit intake of sugary and carbonated drinks. Okay, because they are just empty calories, they are nothing in them. Okay, and they also, are breeding grounds for they bring other diseases that we'll talk about later as we progress on the call. So the number one thing is for you to eat healthy. The second thing you need to do is to manage underlying health conditions. I know most of you on this call may be young, but it doesn't mean that if you have underlying health issues that you will not be able to take care of them. We have seen people that come down with hypertension, diabetic mellitus, even from when they are quite young. Okay, so if you have other underlying issues like that, you need to take care of them. We've seen people in the hospital that were diagnosed of hypertension, but once they feel like their blood pressure is getting normal, they take their hands off the medications, and before you know it, the high blood pressure skyrocket again. And that's the same thing with those who are suffering from diabetic mellitus. Okay, we give you medications, tell you on the lifestyle modifications to do, and then when you go home, you feel that everything is okay, you take your hands off. That is not a way to build a healthy lifestyle that can last you till old age. You have to be health conscious, okay? So manage any underlying conditions that you have. If you're someone that is hypertensive, take your drugs, do all those things that the doctor told you to do in the hospital in order to be okay. If you're someone that have diabetic mellitus, even for women that have approached their menopause, there are things that we advise you to do in order for you to live a healthy lifestyle. Another thing you need to do is to avoid alcohol and avoid smoking. These things, you do them now and you feel like you're enjoying your life, but somehow they pile up to affect you when you're growing old. There is no benefit whatsoever of taking alcohol, no benefit of taking or of smoking tobacco. Instead, these things, they go into your body system and they destroy your liver and other parts of your body system and organs. So you have to be conscious of what you're taking. You have to be conscious of reducing and even stopping alcohol totally. The next thing is for you to get conscious about your medical checkups, okay? Get screened. This will help you to recognize health problems even before the signs and symptoms begin to manifest. When I ask people to come in for checkups, sometimes they tell me, I'm still young, I'm still 30, or I'm still less than 30, why should I come in for checkups? Checkups are only for old men and women. No, that's very wrong. Medical checkups are not just for old men and women. They are for everybody. It will help you to recognize, to pick up some diseases even before it begins to manifest. And one of the things that delineates a good prognosis for anything is early detection. If it can be detected on time, then it can be managed appropriately and you will be fine. Some of the things that we encourage you to come in for, we want you to come in so that we can monitor your vital signs. If for women, we can do mammograph to check your breast and know that there is no lump growing anywhere. We encourage you to go for colon cancer screening, for HIV testing, and for all the other routine medical checkups that people undergo in order to make sure that you don't suddenly come down with illnesses. Okay, the next point I want to make is that you need to get active. Exercise. American Heart Association suggests that you need to have at least 30 minutes of exercise every day. If you're someone who is a busy professional like I am and you do not have time every day to bring out 30 minutes and exercise, you can break it down into 10 minutes in the morning, 10 minutes in the afternoon, and 10 minutes at night. And it's not just exercise of running, climbing, and all that. You can actually walk. Okay, just take a power walk or a brisk walk. When you're coming to work, you park your car at a distance and then trek to your office. Decide to take the staircase instead of using the elevator. Decide to dance in your room. All these are forms of exercise, you understand, that can help you get moving. If you're someone that does remote work or virtual work and you have to sit down for a long time, you have to get yourself your exercise equipment in your house so that you can be exercising in your house. You can register in a gym, or from time to time, you can stand up from your seat and walk around, take short walks around your neighborhood in the morning, in the evening, so that you can get your blood circulating very well. And another point I want to make is that you need to have good posture. We encourage you to have a good posture because if you have a bad posture, it may not affect you when you are young, but when you grow old, you begin to reap the side effects of the bad posture you developed when you were young. So make sure that you sit on the correct seat. Don't hunch, don't sit in such a way that you develop back pain. And if you're someone that works a lot with computers and with screens, get yourself the correct anti-blue rays glasses that will block excessive screen rays from entering your eyes. And then take breaks. It's not every time your eye is on the system, your eye is on the laptop or phone. Always take time to, take your eyes out so that your eyes can rest. Excessive screen time will actually damage your eyes in the long run. Then another thing is you need to learn how to manage stress better. In this our world, there are so many things that trigger stress right now in people. You need to know when you're getting stressed. You need to know your limits. You need to know when to take breaks, when to sleep, when to go for vacation, and engage in other activities that can help you, refresh yourself and recreate yourself. Don't think you're a Superman because you are young. It will affect you in the long run. Okay, take out time to rest, take out time to exercise, take out time to manage stress. If you need to talk to someone, go to the hospital, talk to a psychiatrist or a psychologist. They will help you, teach you better things that you can be doing in order to avoid the root cause of your stressful conditions. The next thing I want you to do is you need to learn how to take care of your body. Taking care of your body is not just bathing. Bathing is part of it. You bath yourself twice a day, morning and evening. And if you can bath more because of the hot weather we have in the country right now, okay, you use deodorant, you use these creams that are appropriate for your skin types. You don't bleach your skin, because bleaching will actually lead to consequences that you will not like in the long run. When you get old, you discover that you have just end up destroying your skin, destroying your kidneys, because these bleaching creams, they contain chemicals that enters your body to go and affect your kidney. You'll be wondering why we have a lot of kidney failures in the country. Sometimes it's as a result of what people put on their body, like the creams they use. So I encourage everyone on the call, if you're someone who thinks that bleaching cream makes you more beautiful, it can make you beautiful, but at the same time, you are damaging your skin. And another thing is you need to do in order to take care of your skin is always apply sunscreen when going out under the sun. Right now, the country is very hot, like I said, and the sun is quite harsh. So apply sunscreen whenever you're stepping out in order to protect your skin. And as much as possible, avoid direct, exposure to this harsh sunlight. Make sure you stay under the shade. If you have to go out, take an umbrella. If you don't have a car, take an umbrella. Use face caps. Use dark shirts, something that can protect your eyes. Wear long sleeve clothes that can protect you. Please limit the extent to which you expose yourself to the sun, because it can actually lead to skin cancer later on. So I believe with these few points of mine, I've been able to convince you that it's very possible to build healthy lifestyles that can help you and last even till old age. So I'll be here for a while. If you have any question to ask, you can put it in the comments, or you can just ask. I don't know how Prosper takes his question here, or if there's any other thing you want me to explain, go ahead.
All right. Thank you so much. Thank you so much, Doc. You really gave it. You really broke it down to make it very simple and straightforward. Thank you so much. So I'll do a quick recap on some of the things we've discussed, and then you take the questions. I'll do a quick recap, and then you take the questions. So just like you said, I think the first thing you said here was becoming super health conscious. I think that was very big. Many people don't even give attention to their health. Just like I said in the ad, they just wait until they get sick, and it's really so bad, and all of that before they begin to give attention to their health. So thank you for that. So becoming super health conscious, and then eating healthy, minding what gets into our mouth, just like you said. Minding what we eat. We should avoid alcohol. We should take balanced diet and all of that. Then you also talked about medical checkups. And medical checkups are not for sick people alone. It's not for people that are sick.
I think Prosper is having some issues with his network. So I think Prosper is having some issues with his network. So I think even my network is having issues. But I've seen someone's comment. You said I should talk more about posture. Yes, posture is very important, because bad posture will come back to bite you later when you're growing old. You see some people, have you ever seen some people slouching while they walk? You'll be wondering, why is this one slouching? Is this one part of Gaiman or what? You understand? They don't really know that they are actually building a habit that can affect them when they grow old. Or you see some people, carrying heavy load. You understand? Carrying heavy load. All these things you are doing is affecting your spinal cord, is affecting those bones at your back. You understand? When you grow old, that's when you realize what you've done for yourself. So for people that even does remote work, it's very easy to just be sitting down at a spot for a time, and then when you are for a long time, and then when you are sitting, you carry plastic chairs and sit, or chairs that are not built to support your back. That is very, very wrong. Okay, if you're someone who works for a long time sitting down, buy what we call ergonomic chairs. These are chairs that are molded to support your lower back, the back of your neck and all that, so that when you sit down, the chair supports you and all that. You are not slouching, you are not sitting in any other posture that is not okay. And then when you lie down, be very mindful of where you lie down. Some of us sleep on foams that are like mountain one side, valley the other side. No, when you lie down, the thing will just dip right in. You will be developing a bad posture. Sometimes when you wake up, you discover that you're having backache, headache. You don't know where it's coming from. It's because of the way you slept when you were sleeping. So I want to encourage you, when you sit down, sit up. When you're walking, walk with the right posture. When you want to sleep, lie down on a bed that can support you appropriately. When you're walking, sitting in a chair, make sure you sit on the right seat. Don't sit on a plastic chair for long. Plastic chairs are not ergonomical, and they will affect your back somehow. When you're carrying any load, carry it in the right way. Don't, carry it in such a way that you feel the pain right here at your back. And anything, reduce the way you carry things on your head, because finally it's going to affect your spinal cord. If you have a way to carry it with, a pulley or something that you can just roll, not pulling it, holding it and all that. You see those people that do bricklaying work, they'll just be carrying block every day, carrying block like that. It will affect them when they grow old. So whatever you do, make sure you are very careful about your posture. Have this health consciousness that you are actually building the health that you want to enjoy when you grow old. I hope I've been able to answer that question. Is there any other question here? Please put in the comment section. Let me go through. Are you still here, Prosper? All right, while we wait for him to join, if you have any other question, please go ahead and ask. Please ask your question. I'm in the comments. I'm in the comments to answer. All right, thank you everyone that was able to join us on the call. We appreciate your presence. You know how the network has been in the country for the past few days, so I think that's what really affecting us today. And for those of us that, despite the network challenges, we are able to join, we appreciate your presence. So I'm just going to do a quick recap of what I've said before for anyone that just joined us. Our topic, we are talking about how to build health that lasts till old age. And I started with telling us that we need to make that health decision, that this is what we really want to do. Be conscious of your health, because that will give you the conviction that you need to do the right thing, that you don't need any other person to, keep telling you what to do. So the first thing I said is you need to eat healthy, all right? Eat balanced diets rich in nutrients. Don't eat carbohydrates morning, afternoon, night. Even some people take it to the extreme, eating only proteins because they feel like they want to build their muscles and all that. Your diet has to be balanced all the time, okay? Now, you have to drink enough water to stay hydrated. You have to limit the amount of sugary things you eat and carbonated drinks. Stop taking alcohol, stop smoking, because all these things will affect your health, if not now, but in the long run. Manage your health conditions. If you're someone that is hypertensive, diabetic, someone that is in menopausal stage, whatever it is, if you have any other underlying health issue, take care of it. Don't think that you are too young, okay? Take care of it, because if you don't take care of it, it's going to affect you in the long run. Then go for medical checkups. Medical checkups, like I said, is not for those that are sick. It's not for those that are old. It's for everyone, the young, even the baby that was just born. Okay, from time, bring the baby for medical checkups, because it helps you to detect signs and symptoms even before they develop, and thereby preventing them. The earlier a disease is discovered, the earlier is going to be treated, and the better the outcome. So don't be that person that says, I am too young to go for medical checkups. Always go for your medical checkups when necessary. Go and check. Always check your blood pressure, check your sugar, check your vital signs. Do HIV testing, colon cancer screening, mammography. For the ladies, go for your pap smear. Go and do all these things. They will help you. Okay. Then get active, exercise. When I say exercise, I don't mean climbing Mount Kilimanjaro or running for 3 hours. No, American Heart Association says that 30 minutes of active exercise is enough. So you can walk, just walk around, dance, walk, take the staircase, anything that you do that can help you get that aerobic exercise and for your blood to get flowing, that is good enough. Even if you don't have time for 30 minutes a day, you can break it down. 10 minutes in the morning, 10 in the afternoon, and 10 in the evening. We get the work done. Then learn how to manage stress. You're not a superman. You have a limit. You have a breaking point. Don't wait till you break down before you begin to recognize your stressors. Get help if you need to. Sleep, go for recreation, go for vacation, go and talk to a doctor or a psychologist if you are not able to pinpoint the root cause of what's stressing you. Reduce your screen time. Most of us, we look at our phone from morning till night. It's affecting your eyes, and when you grow old, that is when you begin to see all the side effects. So please reduce your screen time. Even if you are someone that's looking at the computer all day, is part of what you do. You have to find a way to. There's something called the 10-10 rule. After every 10 minutes, you look away. Look at something that is about 10 meters away, then you look back. You can stand up, take a walk around your room, go out, drink water, come back and sit down. It will help you. Then get a seat that will support your posture. Be mindful of your posture. Don't do anything that will affect your spinal cord. When you grow old, you begin to experience all these issues. Be mindful of your posture. Take care of your skin. Stay hydrated. Use the correct creams. Use the correct soaps for your skin. Don't bleach your skin. It will affect you in the long run, okay? You need to use sunscreen when you're going out. Don't stay under the sunlight for such a long time. It can lead to skin cancer. You need to use shades when you're going out. Use your face cap. Wear long sleeves to protect your skin from the harsh sun. So that is basically what we have discussed in this call. I know there are other tips and other this thing, but for now, this is all I wanted to talk about on the call. So if you have any question, I'm going to go through the comment again. If you have any question, go ahead and ask. I can see that there are no more questions, but I hope you've gotten value from this short time I've spent with you. So if you've gotten value, please put your favorite emoji in the comment section. I want to see your emoji. I want to know that I'm with you and that you're with me. Please put your favorite emoji on the comment section. Keep it coming. Keep it coming. Let me see your emojis. Yes, yes.
All right. The network got really bad. We've been trying to bring that back and working toward it, but then it really took a toll on us. The network messed so many things up. So Dr. Jane has answered our questions and helped us to see how to build health that lasts till old age. And I believe you learned so many things from her, and she did a very good job. And I'll be taking her LinkedIn uh, profile. I would be happy to answer, just like you said, into the simplicity of how this thing is. Okay, so if you're looking to build a health that will last a old age, follow those principles. Begin to be super conscious, eat, get ahead with physical exercise, and every other thing that she said. All right. If you want to connect with Dr. Jane, I'll drop her LinkedIn page after the webinar so that you can connect with her. You can also ask your questions in the community. If you're not part of it, I'll still drop the link so that you can join. And then once you click the link, you join the community, you can ask your questions. If you're already in the community, you can ask your questions so that she can answer them. She can answer your questions. All right, so we're going to be wrapping up this webinar. Thank you for coming. Thank you for giving attention. Now, this webinar was free, but then you paid attention, right? You paid attention. So it is very, we appreciate that you are here and that you are giving attention to your health because it is something that matters. All right, so we're going to be coming to the end of this session. Thank you for being here. Keep on sharing it. Share to other people so that they can keep learning about their health too. Thank you.